Good afternoon. Next, our specific medical challenge is entirely and strictly a complex neurosurgical one: brain tumors. A brain tumor can be primary or secondary. Secondary means metastases from other organs and systems that are affected by cancer. Today, we will probably talk primarily about primary brain tumors, which include both extracerebral and intracerebral tumors. Brain tumors can be located anywhere inside the skull. They can grow from brain tissue, or they can grow from the brain's membranes. And from nerves, these are the most common types of such tumors. Brain tumors also include tumors of the brain's appendage, the pituitary gland, as well as tumors of another brain appendage called the pineal gland or the third eye. Well, these are the most common tumors. To list them, tumors from brain tissue itself, that is from nerve cells, tumors from the brain's membranes, tumors from nerves, and tumors from the brain's appendages, meaning the pituitary gland and the pineal gland. Brain tumors primarily manifest with symptoms in the area nearby or at the exact location where they have developed. These can be a wide variety of symptoms ranging from movement disorders, sensory disturbances, vision problems, to epileptic seizures. Movement disorders can include things like Parkinsonism, involuntary movements. Hearing loss can occur with tumors of the auditory nerve. And there are many different symptoms depending on where the tumor is located. If the tumor is located in the speech center, there will be speech disturbances. If it is in the center responsible, such a person, this center exists. This is the center for reading and writing, so there will be disturbances in reading, writing, and calculation, because there is also a center for calculation. In other words, there is a wide variety of symptoms indicating that the brain is suffering. In addition, the second group of symptoms are the so-called general cerebral symptoms, which manifest as headaches in the case of tumors. They are quite specific. It's a bursting pain in the mornings. There can be localized pain right at the spot where the tumor is located. Headaches may be accompanied by nausea and vomiting. So this headache is actually not quite ordinary. When such symptoms appear, we suspect that there is a tumor, and today it is standard practice in such situations when a person experiences their first epileptic seizure or suddenly develops an impairment of some brain function. We check these functions and see whether the symptoms resemble those of a tumor. Well, for example, vision impairment. Vision impairment can be related to eye diseases, but also at the same time there are vision impairments that are associated with the presence of a brain tumor. After that, we decide which tests need to be done. The most common tests for brain tumors are computed tomography, CT, of the brain, and magnetic resonance imaging, MRI, of the brain. These tests are available. Today, there are enough scanners where this can be done.